So this video is to talk about PT versus OT in the inpatient rehab setting. So the first thing is their differences. PT is going to be looking more at locomotion, so walking, stair climbing, walking on uneven surfaces, wheelchair mobility, kind of getting them back to the being on their feet, moving around. We also look at transfers, mobility, getting into and out of bed, getting from the bed to the chair. And OT is going to be more looking at ADLs, such as like getting dressed, getting clothes on, also look at transferring, also look at, activities of daily living around the house. And they also look at bathroom, getting into the shower, getting to the toilet safely. And then OT also can be involved with like vision stuff, kind of working on patients, like if they've had a stroke, what visual deficits they have, and kind of working on helping to progress that aspect. PT, typically in inpatient rehab, the ones I've been to focus more kind of on the lower body, or we can do the full body, but we have a focus more on like the legs and like the trunk and that kind of stuff. OT is going to be more on hands and shoulders, focusing on the fine hand coordination, that kind of stuff. And we overlap a little bit because we're both helping, to help the patient make progress. Like sometimes I'll work with a patient when they've had a stroke, and I'll do things specifically where they can be up and walking, but also work on things that's going to work on their hand strength. So there's overlap for sure. So those are kind of the differences. How we work together is a lot of times in inpatient rehab, PTs and OTs will be like on a team, team-based work. I think research really looks good on that because you're kind of cohesively working together. So, I've been on a neurology team with my OT partner, and so we'll have like the same patient on our team. And in those situations, like we're constantly communicating with each other. I'm seeing how the transfer went to the toilet, how the transfer went out of bed, and how, their stability is in standing. I'm letting them know how they're walking, how they're moving, what kind of stability is. Can they do like ambulation in the kitchen if they're working on cooking and that kind of stuff. And then also we're collectively talking for discharge planning. Is family going to be able to help patient do a transfer from the bed to the chair, or be able to get patient into and out of the house? So in inpatient rehab, PT and OT are so tight. Like really get to know your OT partner really well in inpatient rehab, because you're constantly communicating with them and you're constantly working towards, getting the patient to discharge home safely. And that's why, another reason why I love inpatient rehab, because you get so close with different professions, and OT is so similar but different to PT, and it's really cool to get that close to occupational therapists. But, what kind of relationships do you guys have with your occupational therapists in inpatient rehab? Because I'm curious. I've been in several inpatient rehabs, and it's different everywhere you go. So I'm curious if every PT is this close with their OT, or if there's a little bit more differences in how close you work together in other inpatient rehabs. So let me know. Thanks. Bye.